In the mid-70s, a group of healthcare professionals in California's Bay Area grew deeply concerned. Infant mortality rates were skyrocketing in Oakland's communities of color. To combat this problem, doctors, nurses, and community leaders came together to form the Perinatal Council. Hi, I'm Cheryl Ladd. Join me as we visit the Perinatal Council. As you'll see, it's making a significant and positive difference in the lives of mothers, children, and their families.
The East Bay Perinatal Council was started because, frankly, babies were dying, particularly black babies from poor communities in Oakland.
Since 1984, the Perinatal Council has assisted women and their families in Alameda and Contra Costa counties in the Bay Area of Northern California. This nonprofit organization exists to ensure that every mother, child, and family receive the services they need to achieve optimum health and self-sufficiency.
A state-sponsored study demonstrated conclusively that low-income pregnant women who receive access to services such as education about how to eat better and manage stress have bigger, healthier babies.
The Perinatal Council offers a comprehensive cycle of care for teen and adult mothers and their families. Case managers follow the mother and child from pre-pregnancy through pregnancy and birth and on to school or employment. Because transportation is often a problem for low-income women, the Perinatal Council case managers go to the client wherever they are, at home, school, or even in shelters.
So we meet them in their homes or their clinics or their schools so that they can teach us what's going on in their lives, and then we can work with them to support them to meet their goals.
We've learned that you must include the entire family constellation in order to make sure that the health and wellness of the entire family is intact. That includes serving the father of the child, the grandparents, or whoever lives in the family system.
The Perinatal Council provides a myriad of services under one umbrella, including the ASSETS program, a group intervention program designed to reduce or prevent substance abuse among pregnant and parenting teens. Clients learn life skills like parenting, stress management, and resume writing.
Girls that weren't in school are now enrolled in school. Many have graduated. Many of our teens are now more nurturing, which is a really important aspect in the lives of their children. They've also gained life skills, support skills, stress reduction skills, and we also seek to reduce substance use and subsequent pregnancies.
The teen programs help young mothers make a successful transition into parenthood.
Our services are provided through one-on-one relationships with the case manager. And we understand that many of our teens are not able to come to us due to a variety of barriers, and our programs are designed with that in mind.
For teens like Asha, the Perinatal Council has been a helpful and supportive partner.
It's just been really great having people in my life to be there to help you, because you can't do it alone.
We found that with the support of a case manager, through the one-on-one relationships, many teens are able to accomplish much more than they dreamed possible.
African American women are the fastest rising group to be affected by HIV and AIDS. The Peer Education Program trains women to educate others in the community about HIV, AIDS, and substance abuse. Early on, the Perinatal Council recognized the need to include members of the mother's family circle in counseling and parenting programs. Men's services were designed to fill this gap by providing guidance to young fathers.
The men's services are designed to help empower the man to understand their role with the mother and the infant, thereby promoting a healthy relationship within the family unit.
Keeping pace with demographic changes, Latina Services was established to help young women with health insurance issues, acquaint them with the Perinatal Council services, and encourage parents to get involved in their kids' education.
Latina Services has made a significant difference in the lives of our clients. First of all, by providing them the skills to weave through the myriad of social services that are available to them. Secondly, by giving them the opportunity to ask the questions necessary to enhance the physical well-being of their children and their families. And thirdly, by providing an environment that is bilingual, an environment that is comfortable for them to come and to ask the necessary questions and to be able to access the services available.
Welfare reform has been successful for some, But for the most fragile families who are not able to secure employment, it has made it more difficult to get the help they need. To fill this gap, the HOPE program was created.
HOPE case managers go out from door to door and try to find families that have not enrolled in CalWorks. They find them and we do an assessment to determine why it is that they did not respond, what their needs are, and try to refer them and then come up with services that they need so that they do not fall through the cracks.
Physical and mental health support can be critical for new mothers dealing with parenting issues.
We find that the counseling is helping not only the teens, but their children, their partners, their families, and eventually, hopefully, the community as well.
The Perinatal Council's dedicated professional staff are the backbone of the organization.
Employees take away from their experience here at East Bay Perinatal Council a high level of training. We show employees how to implement programs, how to wade through all of the paperwork and establish relationships with community agencies, other social service agencies, city and county government. We set the model for training of caseworkers. When an employee leaves here, they can go anywhere.
The Perinatal Council is committed to continuing to serve the changing needs of the Bay Area community. To find out how you can help, call the Perinatal Council at 877-427-7134 or visit their website at ebpc.org. The Perinatal Council is currently engaged in a building acquisition plan to ensure that future programs will be available. Additionally, the Perinatal Council is expanding its donor and volunteer programs. By doing so, it will continue to create programs that are always in the interest of the child. I'm Cheryl Ladd, and thanks for joining me in this look at the Perinatal Council.